Hi everyone. So I'm pretty sure that most of your children who are in the age group of 6 to 8 have something in their mouth that looks like this. And this condition that you can see on the screen, it's most commonly called as lower incisor crowding. Now, now the reason why this thing arises is something called as incisal liability. That means the permanent tooth bud of the incisors, or in simple language, if I say, the all the four permanent incisors that are yet to erupt, or that actually erupt, I should say, they are wider in width than the primary or the milk teeth of the incisors, or the milk front teeth in the lower region. They are smaller or narrower in width when you compare them to their permanent counterparts, that means the permanent lower incisors. Now, because the permanent teeth that have erupted are wider, obviously the space that is there is less, and this causes irregularity in teeth arrangement. Now, why is it that all kids are not having this lower incisor crowding and some people have it or some children have it? That is because as the lower lateral incisor, that means the permanent teeth, the permanent lower lateral incisor, when they erupt, with their eruption, simultaneously what happens is there is an increase in the intercanine width, as you can see on the screen also. That means the width of the arch in between the two canines, that increases. Now when that width increases, obviously that creates space for those irregularly placed permanent incisors to get arranged and to ward off that irregularity or that crowding that was there. But in some cases we see that even after the increase of intercanine width, this crowding in the lower incisor region does not get resolved, and there is still some sort of crowding which is of almost 2 millimeter. Then in that case, if the crowding is just of about 2 millimeter, that means there is only just 2 millimeter short of space for the teeth to align in a proper arch, then that amount of crowding is relieved by something that is called as leeway space. Now what is leeway space? See, we see that in primary or the milk set of teeth, the molars and the canine, their combined width is more when you compare to the combined width of permanent canine and the two premolars. So obviously we have extra space in the molar region in the milk set of teeth. So when those milk teeth fall off and the permanent teeth come up, which were narrower, obviously you have positive space. That positive space, that is almost 1.7 millimeter per side, that is again provided. So this helps in relieving that 2 millimeter of crowding. Okay, now what happens if that crowding is more than 2 millimeter? That means if it's more than 2 millimeter, then in that case the positive space or the extra space that is provided by leeway space will not be sufficient, right, for it to get relieved. Then in that case the doctor has to intervene. And what is the intervention in that case? In that case, as you can see in the picture, the canines, the primary canines or the milk canines in the lower jaw will have to be sliced, will have to be disked. That can either be done with a slicer manually, or you have got automatic motors, okay, or the air rotors. They will disk off the surface. Now when that disking happens, this provides a slowest way, this provides the positive amount of space that is needed, and with the help of the pressure of tongue, the teeth get aligned, they move outwards with the tongue pressure, and you see a symmetrical round lower arch. But the thing that needs to be taken care of is this is only done after the permanent lower lateral incisors have erupted. That means after 8 years of age, because first we give the body to relieve that crowding by increasing the intercanine width. Okay, but what happens if that crowding or the space needed is more than 4 millimeter? Then in that case, because the previous case that we read wherein disking can solve the problem, that was when the crowding was between 3 to 4 millimeters, or let's say less than 3 to 4 millimeters. So in that case, disking of the primary canines can help. But when it is more than 4 millimeter, then in that case, extraction or removal of the primary or the milk canines or canine, that means either both or only one, will be required to maintain the midline and the arch symmetry. That means the proper shape of the arch to be maintained. Now, what will decide the extraction of which primary canine? That will be dependent upon which side you see that the midline is shifting, right? So that, like, let's say if the midline is shifting to the right, that means the left primary canine will be extracted. Whichever way, the doctor will educate you and the doctor will let you know. But the demerit with this thing is, when you extract a tooth before time, then the counterpart, the eruption of that counterpart is delayed. That means if you extract the primary canines early, then this will delay the eruption of permanent canines. So this is one side effect, but in any which ways, it's inevitable. Another thing, if you want to know that what does one then do in that case to maintain that space of the permanent counterpart that is going to come, and to avoid so that that space does not get lost again, there is something that you need to know about, and that is called as space regainer. If you want to know about that, do let me know in the comment section. I'll make a separate video on what we understand by space regainers and what their function is and how does that work, all of that. So that's it. Thank you. I hope I was understandable and I was able to make you understand in layman language what actually this is and why does it happen and what you can do. That's it for now. Take care. Thank you.